Welcome back to March County Connections. Thanks again for hanging in there. This is the last segment, so this will likely be the best.
Yeah.
All right, so we're going to start off. Again, I'm your host, Scott Vargo, County Manager in Waiting, and I'm joined by Karn, Thomas, and Dan, your County Commissioners. So first thing we want to talk about, and I'm sure if you stick around long enough on this channel, you'll see the segment that's specific to this item, but we have a new teen center within the community. So talk about that.
Well, we had a ribbon cutting a couple weeks ago, and it was so exciting to see all those young teenagers hanging out in a place that they really needed to have. A lot of teenagers don't have a place to go home to where there's anybody there. The transportation can be an issue, so right next to the bus stop, right at the county commons, is this facility. It's available every day after school.
Monday through Thursday.
Not Fridays. A lot of abilities for them to network, to get assistance on schoolwork, and there are always our wonderful youth and family staff available for, counseling that might come up at the last second. Just plain old discussions and plain old having fun. So it's really exciting.
If you're familiar with Boys and Girls Clubs, it's something a little bit like that in terms of the concept.
Yep, definitely on a smaller scale.
Right.
But a great opportunity for things to get started and off the ground.
Yeah, they had table tennis out there, TV, sofas, just really a great location for folks to hang out, a safe place.
Right, so kudos to Robin Albert and her team for figuring out how to put that space to use, and more to come.
Yeah, and kudos to the Summit Foundation for helping to fund some of
Foundation.
that, as well as the Tony Gramscis Youth Fund. It's something like that. TGYS.
He's a former state representative.
Yes. Right. Yep. So those two groups came together. They're helping with staffing as well as some of the equipment and activities that are within the space. All right. So moving on. So that was part of the, oddly enough, as I did the walk around tour for what we're calling the County Commons Facility Master Plan, and I walked through that space one day, and I thought to myself, I wonder if maybe we couldn't turn that into a teen center. So that was just a very small piece of what was a much broader, larger project. So Thomas, you want to talk about that facility plan?
So, Summit County government acquired the county commons space, I don't know, 20 years ago or so. And really, we've gotten to a point where we realized that we need to do some long-range planning with regards to how we map out services and how we map out expansion of facilities in that area. And so that's the process that we went through here this last, 6 months or so that we've been working on this. There's some short-term things that we want to get done. We definitely would like a sand and storage building that does not have the back end of the building blown out, right, and exposed to the elements. That would be nice. I know that the road and bridge guys would appreciate that. And so that's one of the first things that we hope to get done. But it also kind of maps out the way that we can grow. We've got some particularly old buildings. Search and rescue is they've got their stuff stored in some really old buildings that are past the end of their life, quite frankly. And so this sort of maps out how do we do things and make sure that we don't miss a beat in terms of services as well. And so, we had the neighbors involved in this. I think that we had some fairly good feedback from them in terms of what we put together and what we planned out. So now all we need is money to build it, right?
Yes.
So, but it's interesting how, my gosh, look at that fleet maintenance building that we've got, right?
Yep.
We never thought we would have gotten the funding for that.
It's like winning the lotto at the federal level.
It was like winning the lotto when $10 million plus dollars dropped out of the sky and we were able to build that facility. So, sometimes miracles happen.
Yeah. We have definitely learned that if you are ready to go, you are in much better shape than thinking, well, we're never going to get there. So plan for it, prepare for it, and then when the opportunity is there, strike and go get it. So we are positioning ourselves for those kinds of opportunities.
Yep.
Okay.
And just for background, the Commons, it wasn't really that long ago in government time, just 20 or so years ago, but we've put buildings in, and then, oh, we need a fleet maintenance building. Oh, we need ambulance. We need this and that. And then there's been an obvious location, but there has never been a master planning process. So it is definitely hodgepodgey and not set up for, in particular, emergency response to be most efficient in the location and the access to the roads. So it was a really important process, long overdue. And there are some things that we can get done right away without money.
Yep. And there are big opportunities for us to pull some of those more heavy, intense uses away from some of our neighbors and move them into a different location within the core of the campus. And again, part of this process analyzed the reconfiguration of the road that comes down from the hospital campus through the commons. By rearranging that, we recapture some additional space for development, and I think everybody around the room was thrilled at that prospect as well.
Yep.
So.
That's awesome.
All right, let's see, our almost last topic for the day is related to healthcare costs. We know that there are lots of folks in our community that are struggling with the cost of healthcare. Dan, why don't you talk a little bit about the efforts that you've been spearheading?
We've been working as a county with other regional partners to explore what federal, state, and local actions we can explore to move forward that will help with looking at the overall costs of healthcare locally, in particular looking at the cost of premiums for health insurance, which by most accounts is still ranks as one of the most expensive in the United States. And so we worked with our Western Slope legislators to introduce a bill that would create one metropolitan statistical area for the state of Colorado and keeping the status quo for people that are in the small and large group plans. Ideally, what that would do is put Summit County in a larger risk pool area. So it doesn't matter if you plug in the zip code for Denver or a zip code in Breckenridge or Frisco or Grand Junction or Durango area, you would all be part of that risk pool area. Well, that particular bill concept got a lot of attention, to say the least. Got the attention of Commissioner Salazar, she's the Division of Insurance Commissioner, and other legislators. And as a result of that concept, the legislators worked with Division of Insurance to come up with a pilot project, more or less, to look at the feasibility and viability and most important, our cost, if we did shift to one metropolitan statistical area for the state of Colorado. So a bill was introduced just a few days ago. It's House Bill 1336. And so it looks at, number one, looking at a feasibility study of doing one MSA for the state. It also has a reporting mechanism that reports back to their findings to the Joint Budget Committee by August 1st. And then another important component of the bill is that it has no appropriation costs clause. So that means that the Division of Insurance pays for that analysis within their own existing budget. Division of Insurance, they have said that they want to have that information. That would be good for everyone to know in the state of Colorado. Doesn't matter, again, what zip code you live in, that this is approximately what the cost of healthcare will be in your particular area. So I personally think it's a real positive step forward. It gives us as locals an opportunity to tell our story. And if you're part of the individual market, you're not part of a large or small group plan, and you live in Summit County, we hear you. You are getting hammered. And we're going to tell a story about that on March 24th at 1:30 at the Capitol. So folks, come down to the Capitol. You'll get more information, but it's an opportunity for folks to tell their story. It'll be downstairs in the more or less health and insurance committee at 1:30 on March 24th. So we think it's a positive step forward.
Great. And we'll, assuming that bill goes through, we will have at least good data, good information about what the impact of that one single statistical area has. And right now, nobody really knows.
Right.
And so there's a lot of speculation about what it means, but this will actually give people some data and some facts to make an informed decision. And how do we want to move that kind of legislation forward in the future?
Right.
Exactly. And I have to thank Representative Millie Hamner, who's a local Summit County resident, as well as Representative Bob Rankin. He represents kind of the Garfield County area. She's a Democrat, he's a Republican. They both understand the importance of this topic. They're both going to get hammered by the insurance companies and the hospitals and the people that want the status quo. But I just, my hat's off to them that they're really being bold to listen to our concerns, and taking those concerns into action. So thank you.
In the meantime, we continue to do a lot to support the community care clinic here in Summit County. We recently approved an expansion for them into space that we, Summit County government, own, so that they can expand their dental services up to the 3rd floor and then grow the regular operation on the 1st floor. And they're the safety net for people that can't afford insurance, and we continue to do a lot to make sure that they're there and can service those people as well. So we're very tuned into this. We understand how painful it is. And I know that it's hard to be patient on stuff like this because it costs so much, but we're making progress, and it's amazing that Dan has been able to get this far on this topic down at the legislature when you understand just how powerful some of the interests are. So we're working on it, and hats off to you, man.
And Dan continues to also meet with the heads of Centura as well as Kaiser, two of the prominent providers within our community, meeting with them to talk about how they could or couldn't work together, different initiatives that we might be able to put in place within Summit County to affect the cost of care from those two big players as well. And so those discussions are ongoing.
We wish that they were more fruitful, but they're ongoing, and they'll
it's
be
complicated.
happening.
Yeah, it's complicated.
It's complicated. All right, so we have one final item. So those of you that are familiar with Loveland Ski Area, on Valentine's Day, I believe it is, every year, they go through and do different wedding, large sort of group weddings within their complex. And somebody that's near and dear to all of our hearts and who is on the other side of the cameras when we do all of these tapings took advantage of that day, and I expect there's a graphic going on at this point.
Right, exactly.
It's cutting you off. It's cutting off.
Some sort of a photo of some sort
the
of
screen gone
The
black?
newlyweds.
The screen gone black?
So there are newlyweds in Summit County. Brad and Nell got married.
She looks great.
Really looked great skiing in that outfit.
We never follow that. We're always going over.
Time?
So again, hopefully it's a collage of photos now from the events, from the honeymoon, etc.
Right.
Congratulations go out to you and Nell, Brad, and we wish you the very best.
It was a snowy afternoon and really, really wonderful, really wonderful. So congratulations.
We hope we've painted a picture. All right, we are done. Thanks for sticking around, and there'll be a special segment all about Brad and Nell shortly following this.